Hello, Nurse.org. I'm Tiff Gibson, owner and CEO of New Nurse Academy and your favorite nurse educator. I'm going to be spending the day with you, showing you what I do here at the hospital, what I do with my business, New Nurse Academy, and how I'm adjunct faculty for a BSN nursing program. So I'm looking forward to showing you what it's like to be a nurse educator and a nurse leader. Please feel free to send me any questions. I'll answer it throughout the day. I'm about to start a meeting for work, but I'll be back very shortly to tell you all about me. See you soon. So now that my meeting is over, I'm back. So at the hospital, I am working at a level 2 trauma center outside of Philadelphia, and it is a magnet hospital. With that being said, we do have a nurse residency program that I hope to facilitate. I do the onboarding and orientation for our ancillary clinical staff. I also am the chair of our suicide prevention committee and a part of the workplace violence task force. And my most favorite job of all is being the diversity and inclusion advocate for 2 hospitals, as well as our outpatient centers and home care, because creating equitable and inclusive environments to me is number one in healthcare as a nurse. So while at the Children's Hospital, I worked on one unit the entire time I was there. It was the adolescent and nephrology and gen med unit. So I would see 6-month-olds that had horseshoe kidneys or was born with one kidney, all the way up to patients who had kidney transplants and needed peritoneal and hemodialysis, which I'm certified in, as well as the adolescents and all the crazy shenanigans that they get into, regular pediatric things, but then like drug overdose, eating disorders, behavioral issues. So I am a certified pediatric nurse. I've only worked with peds at the bedside, but while at CHOP, I grew my love for education, precepting, being a charge nurse, and wanting to be a nurse leader. I'm all about being radical in nursing. I'm all about practicing with a questionable attitude and being extremely inquisitive. The best question you can ask in a conversation is why. So even if you're studying for the NCLEX, knowing the rationale and knowing the why, the how things happen is important. When you're at the bedside, understanding indications and orders and treatment is important. Understanding your patients and their point of view and their perspective is really important. So why is a great question. I'm all about changing shit up in nursing. Yes, I curse because I don't trust people who don't curse. And making sure that the outdated norms that we have in nursing, the generational norms, the cultural norms, I don't know. I don't know what you're studying, where you're going to school, what your practicum requirements are, and where you live. So I'm not sure how to answer that question for you. Absolutely. You can become certified as a diabetic educator. You don't need your master's for this, just specialty certification. Start showing that you can do this by teaching and educating your patients, and then ask for the promotion. I'm so glad you asked this question. As an educator, you are the person's first line of defense. You are their research. You are the expert. So how can you be an expert if you don't have the experience, right? So about 3 to 5 years before you really get into the role full time. Thank you for asking this question. I became an educator because I found that I was really good with taking complex nursing concepts and making them easy for people to understand, whether you're a patient, whether you're a student, or you're at the bedside, and it's fun. You can be a nurse educator and be a leader, but you can also be a bedside nurse and be a leader. You don't Hey everybody, I'm getting ready to go live in about 5 minutes. So get your questions ready about all things nursing education, adjunct faculty, professional development. I'm looking forward to talking with you. See you soon.